to stay in balance?
Basically, you really want to focus on the posterior. I always say focus on the back. You want to get that external rotation where your shoulders are standing up straight.
Continuing with New Year, New Me at the Westin Fort Lauderdale Beach Resort, I'm now joined by Dr. Sam, and in a little different scenario. We're in the gym this time instead of in your office. So we're talking about what's good for the new year and what we can do for longevity and take care of ourselves so that we can keep working out. What do you have to say?
Well, Hunter, you know, new year, new me. I always say, people say, I've got your back. What about getting your own back? The biggest thing I see in my office is a lot of people, they've been sitting with poor posture. They've been moving the wrong way. New Year's hits, they want to get in shape, but they're in this kind of caved in posture. So doing push-ups and chest presses and everything else may not be the best thing for them. You want to focus on your own back and activating those muscles of the back and the back of the shoulder.
So what do we have to do to be able to stay in balance?
Basically, you really want to focus on the posterior. I always say focus on the back. You want to get that external rotation where your shoulders are standing up straight. So behind you, we have a rope here, which a lot of people use for rope pull downs for their triceps. However, you can use this in another way. One of my favorite exercises for posture and biomechanics, two of them. One's going to hit the middle of your back, one's going to hit the back of your shoulders. So go ahead and start for me. I'm going to show you what we're going to do. Hunter's going to grab the rope like this, and he's going to pull toward his chest. You're going to slightly pull towards your chest, just like that. You notice when he pulls it towards the chest, he's activating these muscles right in here, inside of the shoulder blade. That's going to help to bring it back. Then go ahead and release forward, and then pull again. You notice he has an overhand grip on the rope, and that's going to be really good. He has his back straight, his head is slightly elevated, and he's activating all these muscles in here. This is going to be really crucial because you want to get those stabilizer muscles around the spine. Instead of pulling towards your chest, you're going to pull it towards your eyes, a face pull. So you're going to do the same grip, and you're going to pull towards your face. There you go, perfect, and come back out. What he's doing here, when he's pulling toward his face, he's activating these areas, which is behind the shoulder. This is going to help a lot of times with posture because, like I said, most people have that caved in forward, and what that does, it wears and tears on the shoulder. This is why people have rotator cuff injuries, shoulder surgeries are on the rise. You want to bring balance to the shoulders by activating the backside, not just the front.
Excellent. Well, I definitely feel that. And one thing I also notice is that I have the tendency to still roll forward even while I'm doing that. Is it important to make sure that my shoulders are still back?
Yes, you actually did it, and I think you may have done it subconsciously, but I've noticed that a lot of people want to cave forward and they want to pull and they jut their head forward like a turtle. I always say, listen, get in your stance, bend your knees, put your butt back a little bit, and once you pull, you're kind of pulling back, not jutting forward. So you're really stapling yourself into the ground before you go ahead and start with your movements.
Perfect. Well, Dr. Sam, thank you so very much.
Thank you.
We've got more SoFlo Health ahead, so keep watching, but first, this.